Okay, hi guys, this is LaQueen Battle, a medical assistant first aid, and I'm doing a video on the use of Narcan, naloxone spray, in response to the city of Quincy's report that they had over 3 to 4 drug overdoses, opioid overdoses within a past 1 hour period this past Wednesday, September the 23rd to the 24th, in the city of Quincy. So I'm going ahead and do a quick video in response to this drug crisis in the city of Boston, a massacre all over. So wherever you are, hopefully you can use these techniques and do what you can to help somebody who is going through a drug overdose. Now, this is not a substitute for emergency assistance. If you do need emergency assistance, please contact 911. Okay, and again, if you do have any other questions about the use of Narcan, please contact your local health department, as well as speak to your local healthcare professional about how to use Narcan and what to do if somebody is having a drug overdose episode. Okay, all right. So the first thing you want to do is, if somebody's going through a drug overdose, you want to check for signs and symptoms. They can include, of course, if somebody, this is a little bit different than having a diabetic episode or having alcohol withdrawal symptoms or having a seizure or anything like that, but it's usually different when somebody's having a drug overdose. They can include the person's not talking, they're passed out, they're snoring, they're gargling from their mouth. Of course, this is still a little bit different, but they're gasping for air, there's gurgling sounds coming from their mouth, and their fingernails are bright blue and bright purple, as well as their lips are bright blue and bright purple. When you see these signs, they're usually the signs of a drug overdose. A little bit different though, when a drug overdose, you want to call 911 and let them know that I think this person is having a drug episode situation, and I notice these symptoms. And what do? I do have Narcan on hand. What I do, and what else you notice about about that person, whether they ate something, they took some medicine, and if there's any other kind of substances, drugs around them in the vicinity. Okay, so the first thing you want to do, of course, after you call 911 and that person is unresponsive and you see the symptoms, you want to start administering Narcan as soon as possible. You want to put that person flat on their back. Make sure nothing is blocking the airway, nothing is blocking their airway, their nasal, as well as their mouth, oral airway, and then put that person flat on their back. Put the Narcan into one nostril and take the plunger and press the Narcan fully into one nostril. Now, after this, you want to start administering the rescue breaths. If you are trained in doing CPR, you can start doing CPR, but if you're not, then you can start doing rescue breathing. Within 2 to 3 minutes, if that person does not respond, then you can start doing another dose of the Narcan if you do have another dose of Narcan on hand. If you don't, continue doing rescue breathing until 911 arises. Okay, now after the 2 to 3 minutes is up and you have another Narcan, they come in two in a box. Okay, if you do have another Narcan on hand, after 2 to 3 minutes is up and a person is not responsive, then you want to continue the rescue breathing. And now after the rescue breathing and a person does revive and come back, then that person may experience withdrawal symptoms, and they may experience all of a sudden shock, like, oh my God, what happened? I don't know what happened. And let the person know that we just administered Narcan and that you just had a drug overdose, you just had a situation, and we just gave you Narcan. Okay, let the person know that you just gave them Narcan. That they also may experience symptoms like diarrhea, headaches, fever. They may have a rapid heartbeat. You can check the pulse. The pulse would be a heartbeat like called tachycardia. They also may experience having a fever, a runny nose, sneezing, goosebumps, as well as, of course, cramping and any other kind of symptoms that are different for each and every individual person. So after that person revives themselves, they may want to overdose again or experience have more drugs again. But let the person know that 911 is on their way and that the symptoms of Narcan will usually the withdrawal symptoms will usually wear off within 20 to 30 minutes, and they'll go back to normal. But it's usually different for each and every individual person. Okay. Now again, the first dose of Narcan usually wears off within 20 to 30 minutes after you administer the first dose of Narcan, and it doesn't work. Continue the rescue breathing. That is the technique that has been used by various health departments across the United States. If you are training CPR, you can start the chest compressions as well as the rescue breathing. But rescue breathing is a technique that is used by most health departments in using Narcan as well as in rescue breathing. This is the technique that's used. Okay, so again, this is LaQueen Battle. I really appreciate your time. If you do have any other questions, please talk to your local health department on how to use Narcan, as well as if you know somebody that is going through a drug overdose situation. The training is free across the United States. There are various videos all over the internet that will show you how to use Narcan, as well as your local health department, and even your physician or your local pharmacy can let you know how to use Narcan. Narcan is available over the counter in retail form within about $30 to $45 for one box. It comes in 2 sprays for one box. Okay, it's Narcan. Okay, it's now available over the counter for retail sale use in various pharmacies, CVS, Walgreens, Target, Walmart, available now for retail sale. Okay, so this is LaQueen Battle First Aid Responder Services. Hopefully you can be in need and help somebody who's experienced a drug episode, drug overdose, and help them through that emergency, help revive that person, and be in need and save a life if somebody is having a drug overdose. You can be in need and save somebody's life through the use of Narcan. God bless you guys. Be safe. Again, if you do have any other questions, please contact your local health official and your local health department for free training on how to use Narcan, and get your free box of Narcan today. God bless y'all. LaQueen Battle. Take care.